Good afternoon, everybody. Welcome to Lunch for the Soul. I'm Melissa Wilson with Fox 26. In fact, I'm in our busy newsroom right now, so you never know what's going to be happening behind me. I will try to mute myself here and there if it gets hectic, but again, just telling you, you never know what to expect. Wow, do we ever have a precious guest today who has been through a whole lot the past few months, but what a strong lady she is. Her husband has been by her side through it all, and of course, she has the surgeon of all surgeons, and I'll introduce him to you. What a special treat to have him with us today in just a few minutes. But first, let's start with Linda and her precious husband, Larry. Welcome to you both. Thanks for being here.
Thank you.
How are you?
Well, Linda, you have quite a story to share. And the first time I talked to your husband, he told me he was so proud of you because you, quote unquote, have been screaming from the mountaintops, trying to get the word out about oral cancer. So let's go back to what was going on with you and why you are really in the middle of this important awareness campaign.
Oral cancer was something that was not on my radar. I started having some symptoms last fall. Kind of thought, oh, I bit my tongue. The discomfort I was feeling was intermittent, so I didn't take it very seriously. It eventually became more consistent, and then more consistent. It was pretty much discomfort all the time.
Mm-hmm.
I finally took a look at my tongue and realized there was a white patch on the side of it. And so I kind of kept an eye on that, and it wasn't going away. And I didn't feel like I was biting my tongue that much. So I decided I probably should have my dentist take a look at it. I'm very good at going to the dentist twice a year for my checkups, and I had been in June. I didn't have any issues. So this was several months later, and I went in for my second checkup of the year and just mentioned that there was something on my tongue. Could they take a look at it? So they used a special oral cancer screening tool. It's a light, a certain type of light. And they said, well, there's some suspicious tissue. And they wanted to send me to a different doctor for a biopsy. I went the very next day, and they did the biopsy and had the results about a week later, a little less than a week later, and was absolutely knocked down that I have cancer. I don't fit the typical mold for oral cancer patients. I'm not a smoker, and I'm not a heavy drinker. So it just kind of came out of the blue. And immediately, literally, we walked out of the appointment with the doctor where I got the diagnosis, and I cried for a couple of minutes. We got into the car, and I realized I need to let people know that this can happen to anybody, and you can't ignore anything that might be unusual to your body. Just get to the doctor, get to your dentist, whomever it might be, and get it checked out.
Well, thank you for saying that. And Larry, you are so thrilled that she's trying to make a difference through her own story, right?
Oh, yeah. I mean, if you knew Linda, she is a very private person. And the fact that she wanted to let people know this, it was on her Facebook page immediately, just telling people, like you said, shouting it from the rooftops. And this is just so uncharacteristic of her that I was really kind of taken aback. And I thought for sure she was going to want to hide this and, not tell anybody. And I'm just so proud of her for looking at it from a totally different angle and saying, I can maybe help somebody else, go through this in a better way. If they have it, get it caught early, and like we did, and have a much better outcome than potentially.
I mean, prevention is absolutely the key of that early stage, right? If you haven't been able to prevent it, then to get it early stage so that you can protect yourself and even your life. Let's bring in now Dr. James Melville. Hello. Thank you for being here.
Hi, Melissa. Pleasure being here.
Well, you do some magic over there at the UT Health Houston School of Dentistry, and I know that this family is so appreciative of your skills and the
We
just
are.
the camaraderie that you've been able to have with them during this difficult journey. So you just heard Linda describing what her symptoms were, which was just almost what maybe looked like a white canker sore. Is that what you hear more often than not when people have something like this?
Exactly. It's just a lot of times just human nature. You get something in your mouth and you think it's going away. So you just keep thinking it's going away and it doesn't. And it's just the best case scenario is to go look for help.
Mhm.
Be a personal advocate looking for help because something might be off. If something like an oral lesion that's not going away. So Linda was perfect case scenario for that because she got treatment early on and great outlook, great prognosis.
Well, it can be confusing to hear her diagnosis as well because there have been some very famous people who've come about with oral cancer, but it was actually caused by that human papillomavirus. Hers, squamous cell carcinoma. And I think people know three types of skin cancer, right? We hear melanoma, the big boy, we hear basal cell carcinoma, and then squamous cell carcinoma. And people may not realize that squamous cell can actually be on any mucous membrane, right?
Absolutely. It's basically the lining, if you can think of your mucosa, the
Mm-hmm.
lining of your cheeks.
Mm-hmm.
It's just the mutation in that. And a lot of times it's by the combination of smoking and drinking. There can be a mutation in that gene. So it's kind of like a factory line, assembly line. There's an error made and it's continuing. And the classic example I give to the patient is Lucio ball with the chocolates.
Mm-hmm.
It constantly happens. There's a mutation and that error confound keeps multiplying. So it really is unique in Linda's case because she was not in that demographic
Yeah.
where she was a drinker or smoker. And we find there's about 54,000 patients who get oral cancer annually.
Mm-hmm.
And within that subset, there's about 20% that we don't really know the cause of their oral cancer and squamous cell carcinoma too.
Mm-hmm. Mm-hmm. Linda and Larry, I'm going to bring you back into this. So you hear your doctor talking about how it's unusual that you got this. Let's talk about how you dealt with that, with this diagnosis. Did you pray? Did you get on your knees? What did you do in order to get you through this tough time?
I have a pretty solid faith. I have friends who immediately were praying for me.
Mm-hmm.
And I felt the comfort I was getting. We've got friends who started prayer chains. I was receiving cards from people in various states that had heard about my situation. So that was just all very comforting. Plus, working with Dr. Melville, that also just brought me a sense of peace,
Yeah.
confidence. He had a lot of confidence, which helped me have confidence, and just knowing people, so many friends from our church, and then total strangers as well
Mm-hmm.
that were praying for me. Just I was very fortunate to go through this journey with a sense of comfort.
Mm-hmm.
So we're Catholic, and I'm part of the Knights of Columbus, and I have the ability to be in front of a lot of different councils.
Mm-hmm.
So I had a bunch of different councils, which means literally hundreds of nights were praying for Linda, and still are. I still get questions. I still, tell people are telling me that they're still praying for her. So it's really awesome that we have that kind of backing and support from our religious community. It's just awesome.
Wow, it makes a huge difference. Dr. Melville, I don't know how comfortable you feel about talking about this, but I'd love your opinion because as a medical reporter, I see that people who have prayer chains like that, who have the support, who have faith, tend to heal better. Do you see that as a medical doctor? No matter what your belief is, there are all kinds of beliefs, and not picking one religion over the other.
Yeah, absolutely. It's just the attitude, that positive attitude. I find that patients do really well is having a positive outlook, and the mind is a wonderful thing because it kind of guides you. So if you have the positive outlook, I find patients do really well post-operatively.
Mm-hmm.
Really, your thought process and just the group gathering, family support, that all works together.
Mhm. And also getting that early diagnosis. I want to go back to that because I think that's really important. So Linda wasn't sure what to do. So Linda, your first step was to go to that doctor, to go to your dentist, and then they did that oral exam with the UV light you were talking about. How important is that, Dr. Melville, to talk to your dentist if you don't feel like they're looking at anything besides your teeth? I mean, they really need to be looking at everything, right? To search for perhaps an oral cancer in there.
Absolutely. So yeah, a lot of times you are basically, you know, your body better than other doctors or any other doctor. So if you have something that's kind of bugging you, a lesion that's not going away, and it might be in the crevices or in the shadows that really no one can see, bring it up to your doctor or dentist and they'll take a better look at it. And that happens to me a lot. I'm surveying and the patient will come up to me and say, you know what, there's something that's bugging me and it's better safe than sorry. So there's a little, oh, that's absolutely nothing. And I give them a sense of relief by saying that. But I'm actually very thankful they actually brought that up, but I can pay attention instead of looking generalized. I can focus on a certain tree and that patient.
Linda and Larry, I know you were both relieved to find out that you caught it early enough where you only had to, I say only, but only had to undergo surgery, which I know was still very difficult to deal with but you didn't have to do chemotherapy and radiation since it was early stage, and that's huge.
Yeah.
But let's talk about that surgery. I mean, it was still fairly complicated. We're talking about taking tissue from one body part to another. So first of all, Dr. Melville, I'll start with you, and then Linda, let's talk about how you work through that because honestly, I mean, we're females. I can't imagine not talking for a couple of weeks. So we'll get to that in just a moment. Dr. Melville, let's talk about what you did in order to do everything you could to preserve and save her tongue.
Sure. So the main thing with the tongue, it's such a dynamic organ that it's your taste, your speech, a lot of your just personality. It's based on it. People don't realize. So my goal with any patient is try to preserve that normality. But the great thing about Linda, because it was caught early, we are based on the depth of invasion, meaning how much that cancer is invaded into the underlying tissue. Because of the early detection, we're able to preserve a lot of her nerves and musculature. So we removed the lesion. During the surgery, we actually sent all the tissues around for what we call frozen sections, make sure all the pathology is clear. There's no cancers around the margins. Then we use the skin graft to reconstruct the tongue so her tongue would not be tethered down. So just kind of evidence today, she doesn't really have any speech impediments and no drooling issues. She can fully taste everything. So that is the biggest comfort for me, is that ability to give her back her sense of normal life.
Okay, Linda, let's bring you in. So what was that like? We're talking a liquid diet for a couple of weeks, only writing notes to your husband. What was it like?
Well, I think he enjoyed it a lot more than I did.
We went through a lot of paper.
Yeah. Yeah, we had the big yellow legal pads and just writing notes and notes and notes.
Yeah.
Thank goodness for text messaging, so I could just keep everybody up to date. So that was difficult, and the liquid diet was difficult. It's just a very foreign feeling to have any kind of surgery in your mouth, on your tongue especially. You don't know how much you use your tongue until you can't use it. And it was frustrating, really, to try to drink. And then even when I could eat, it was just frustrating to just get through the new norm.
Yeah. And I'm sure it was painful, right? Let's talk about that bolster, Dr. Melville. What did you have to do in order to protect where you had the surgery and how she dealt with that? Because when you were describing it to me when I talked to you not too long ago, I was a little overwhelmed by it. It seemed almost scary and uncomfortable, but she said not painful, so that's a good thing.
Yeah, so the bolster really is just a sense of a cotton stuff, kind of a sausage casing looking thing that's in a plastic. And because of a skin graft, we don't want any of the skin floating up because it won't adhere to the tissues underneath. So almost like a tent, we tied, and Linda can attest to this. There's multiple sutures that are just pressing that tissue right along the entire length of the defect where we took the cancer out. And we have to let that sit for probably about, I think for Linda it was 14 days, so about 2 weeks. So she had to kind of bear with that. And I told her, it's going to be very miserable for you for 14 days. But once you got out the full skin graft integrated, it took a little bit for her to get used to kind of the feeling. but within about 2 weeks, almost back to normal. I think she's pretty much 99% back to normal now.
Linda, how do you go into mind over matter with something like that? I mean, you are on your own in this. Everybody can love on you and support you and do it, pray for you, but you're the one who has to work through it. How did you do it?
I think just the fact that Dr. Melville was able to get it all on the first try, that gave me a lot of peace. I knew that there was a good outcome. So any fear I had, that was gone. So it was a matter of really just listening to him, following the directions, knowing that this too shall pass. We'll get through this, and just keeping my friends updated. And I have friends who are dentists, who are dental hygienists, and they've been asking me questions. And, how did you do this? Or what did that feel like? They were asking, what can I do to treat my patients in a way that maybe I can help them even more than I thought I was already. So just to kind of be an example. And it is scary, but if you're getting your checkups twice a year at least, early detection, like we just keep saying, any cancer, early detection is the key. Don't push it aside. Pay attention to what's going on.
It's so easy to be scared and not go be seen, isn't it? But you did, and thank goodness you didn't do that. You got to look at these tiny pictures. I'm sorry they're pulling up as thumbnails, but I love the pictures of you and your beautiful family. How much does it mean to you just to have that support system?
Oh, it's huge. It's huge. Both of our daughters and son-in-law are not real close by, a couple hours and 4 hours away. So I couldn't see them on a daily basis, but they would check in. And I know that they're thinking about me. And I try to just keep them updated and the family. We have family all across the United States. So just a lot of support from everybody. Absolutely.
Yeah. Well, you just have an incredible awareness campaign on. Any last thoughts as we wrap up today? Every one of you, give me your all of this awareness campaign. Dr. Melville, we'll start with you.
Oh, well, early detection is key. And also, like you were saying, faith, positive attitude, and more lines of the surgeons. We just put stuff together in alignment. And it really takes biology, your maker, whoever it is, God, Jesus, Buddha, whoever, Allah. But it's Mother Nature that heals you. So from a surgeon perspective, we try to align things, remove stuff and align things properly. But it's really Mother Nature or your creator who heals you. So having a positive attitude, faith actually helps a lot. And I think that was kind of the point that Linda and you were making as well. And I 100% agree on that.
Very much so. Linda?
Well, everything Dr. Melville said. Also, having somebody who can walk with you through the process. I call Larry my patient advocate. Dr. Melville can attest to that as well. Just knowing that there's somebody who is hearing everything that the doctor is saying, because sometimes as a patient, it doesn't all register. I know that there's been times, especially when I got the biopsy results, I checked out for maybe 30 seconds. I couldn't tell you what the doctor was telling me at that point, but Larry was there. So having somebody walk with you through the journey is important. Absolutely.
And Larry, you're the hero here so far, but last from least. Go for it.
So I think what she just said is important, because having two different sets of ears to hear what the doctor is saying is important. And not only that, but we recorded the appointments as well, just to make sure that we didn't miss something. Or if we both heard something maybe a little differently, we'd go back to the recording to get it right. So that was kind of important as well. And I'll just want to say that those 2 weeks with the bolster in were honestly very quiet around here, too quiet. And so I was glad to see the bolster come out as well. It was nice to be able to, talk again and enjoy, our conversation. That it was a long 2 weeks. And once that was over, everything just started falling into place a lot better. And just, it's just the normal healing process at that point. And that's slow, totally is slow. And I don't think it's over yet, but we're in a good place, and we know it could have been a lot worse. And we're just happy and
Very thankful.
blessed that it worked out well.
So beautifully stated. And I just feel the love between you two. You're such a lovely couple, married almost 40 years, a few years to get to that. So you just I just feel it. It's really incredible. Well, congratulations on your huge success of this medical story. Dr. Melville, thanks for all you do over at UT Health School of Dentistry. Again, you guys are powerhouses. You help so many people in our community, and honored to have all of you on here with me today.
Well, thank you very much.
All
Thank
right.
you.
Take care of
Thanks.
you. Only good health from now on, Linda. That's an order from your medical reporter.
So,
Thank you.
All right. Thanks again, everybody.
all right, bye-bye.
Bye-bye. And I want to encourage you to join me every Wednesday here for Lunch for the Soul. If you happen to tune in late, go to YouTube. You can find us on Fox 26. And otherwise, we'll see you on air at Fox. Have a beautiful day, everybody. Thanks for being here.